day in, day out, we hear about schools where people have tested positive. Thankfully, it looks like some of the school administration have now figured out a way to spot it quickly when someone tests positive, test the people they've been into contact with, and ensure that none of the students will get it again. Our colleague Ni Aike Okwain has a story about Akosombo International School and the teachers and students who contracted the coronavirus. We'll take a look at that story and then we'll continue the conversation.
International School in the Eastern region had about 553 samples taken on January 28, 2021. Out of these, 73 students and 9 staff tested positive for COVID-19. The service says adequate measures have been put in place to ensure the virus is contained in the school.
And the national and the regional team have visited the school, done our assessment, given our recommendations on how to improve the social distancing among others protocol to cut down spread. And so all of them are well and isolated, and those who are close contacts are still being observed so that we can contain the spread.
The Director General of the Ghana Health Service, Dr. Patrick Kumar-Buaje, also indicated that about 23 schools in the Greater Accra region had recorded 56 active cases of the disease, with 8 cases from about 7 schools in the Central region. He provided an update during a media briefing in Accra.
You can see that we also have some suspected cases of about 166 that we are still following up to see. And we have some staff also affected in the schools. Central region and all the whole region has reported 8 cases from about 7 or so schools. 2 of them have already recovered, so they have 6 active cases among the schools in Central.
Despite the available data on the spread of the virus in schools, an advocacy group, the Child Rights International, and some other teacher unions say this does not warrant the closure of the schools.
I think that we've not gotten to a level of risk to say that we should withdraw children from school based on the indicators. So there's a need for us to see how those indicators are playing out, for us to come to the conclusion that we want to close our schools.
So that's Ni Aike Okwain with that story. And the beautiful thing about this is that Akosombo International School is a private school.
Yeah.
So can you imagine all the public schools out there that students are going to, parents have no idea how many of them have tested positive. There's a lot of anxiety around it, and parents are going to talk about what you can do, even how to handle the conversation with your child should they hear that a friend of theirs have tested positive.
Yeah, absolutely. So Dr. Hilda Boyd, who is no stranger to this show, has joined us. She's a pediatrician with the Kolebu Teaching Hospital. We want to find out boarding schools and COVID-19. What parents need to know. Good morning, Doc.
Good morning.
How are you?
I'm fine.
It's good to have you back.
Good to be here.
All right. So this story, what jumps out at you immediately when you heard this story?
It's not a surprise, or it's not something to be shocked about. And I'm happy that the health authorities are in charge and they are on top of it. So it's reassuring. Yes, it's not a surprise or a shock. And it's reassuring to know that we are on top of it.
Yeah, but for parents who are watching us who may be anxious and worried that their kids are going to boarding school, they don't know what's going to happen, how do they even come to terms with the possibilities that this school that my child is attending, someone might test positive for COVID, and I shouldn't just go there and freak out? How do they even come to terms with it mentally?
I know that when students were going back to school, it was not a requirement for them to test for the COVID or like test positive or negative, like for us to be sure of their status before they went back to school. So definitely there would be some who were positive from home before they got into school. And there is the possibility of spread in school because you're putting people together. And we are in a pandemic, so if people are getting the infection, we should not be like shocked or surprised by it. It's just that we should know what to do when the infection occurs. And with the parents, for example, your child is in school. Your child needs to be in school at this point in time, because I think we all know that it's not everybody who can do the virtual schooling. How many parents even have the tablets or the laptops, let alone give one to their kids to study with? So school is important. Now, if somebody tests positive for COVID in a school, parents should not be shocked or alarmed or overly anxious. The schools have been mapped to healthcare facilities, and so there is some oversight over what happens in the school regarding COVID. And COVID is a public health issue, so we've got our eyes on it. So once somebody tests positive in school, there's follow-up by the health authorities to ensure that the person gets well. Another thing is that the schools are supposed to have isolation facilities, so that once somebody becomes unwell or tests positive for COVID, the person does not mix with the other students whose status we don't even know, and the contact tracing is done also. So parents should not be overly anxious. And indeed, sometimes it's understandable. You are not with your child and your child is not well. You're not sure whether it's COVID or not. You're not really even sure whether the school authorities are doing what they have to do, whether the health care professionals are really on top of it or not. But the other thing too is that you may not be able to take care of your child adequately at this time. So once there's somebody who has that oversight to ensure that your child gets well, relax and work with the school authorities so that your child gets better. Don't panic. You know, you may be tempted to say, I'm going to bring my child home. I'm going to bring my child home. But if you are going to bring your child home and you don't have the facilities to isolate your child at home, you may not even be sure of where exactly you are taking the child at that point in time. So then it's better to just allow the school authorities to do their job and work with the healthcare professionals to ensure a child gets better.
Okay, so the instinct for every parent is to panic. Okay, this is not even about your child. You hear that some children in the school. So you're saying that we shouldn't rush is going to go and remove our children from the school.
No, we shouldn't.
We shouldn't do that.
No.
Now, when your child tests positive, how can you support that child, knowing that the child is being taken care of by the school? What can you do? I mean, whilst you're there, most parents will feel very helpless.
Yes, so this is where the school authorities really come in. There should be good information flow. We know that our parents are anxious, and rightly so, because their children are unwell, whether COVID or not, but most especially COVID. Communication should be good. Parents should be regularly updated on the health of their children. If possible, they should also be able to speak with the healthcare professionals who are taking care of their child, so that they are reassured, knowing, okay, my son is asymptomatic, for example, or my son has so and so and so symptoms. These are the things that we are doing for my son, maybe Kweku Jr. These are the things that we are doing for my son. You see, so then it's very reassuring and calming. The schools should not try to hide whatever is going on, but there should be good information flow and good communication. Even for us healthcare professionals, when you communicate well with your patients or your clients, you're more likely to get them on board or have them like follow whatever plan that you have for recovery. It's a discussion, definitely. And so it's important that our parents have at least that information and are reassured. Where possible, they could do a socially distanced visit or something, where possible. Yes. If not, they should just be constantly reassured. And I'm sure the healthcare facilities will take care of the medications that they have to be on, and also parents don't need to buy those medications and send them to the school. So that's another calming something. So we should communicate well with our parents so that they know what's going on with their children, especially since they don't have their eagle eyes on them when they are sick.
Speaking of communication, how do we deal with the mental health of our students while they're in school, especially from the side of parents? How do we ensure that we protect them from the stress that come with just testing positive, as well as the possibility of even testing positive?
Generally, we all know by now that there's a pandemic going on, and we know that we could all get infected. So you could get it, I could get it, we could all get infected. And if somebody gets infected, we know that, especially for children, we know that they are more likely to become asymptomatic or without symptoms, rather than having even the mild symptoms or having the severe disease. So that's one aspect. We also know that if somebody gets the infection, it does not mean that the person has been like careless, or, there are people who can't even seem to know what happened or how they got it. So that is another. Anybody can get exposed at any point in time and pick the infection. So we should not tag people as irresponsible when they get the infection. There's also help available. As in, if you become unwell with COVID-19, there's help available. There are treatment protocols to follow. So it is not a helpless situation. You should support each other. Parents should, so some of these things that I have mentioned, parents should tell their children or speak to them even ahead of time. They should also speak to them about taking care of themselves well. They are maintaining the protocols, putting on their mask, doing all the things that they should do. But even if they happen to become unwell, they should not be alarmed. The love is still there. The family is there for the child to support the child. If they have any feelings of anxiety or feeling stressed out or feeling low, they should be free to communicate with their parents. And if need be that a clinical psychologist comes in or extra support is needed, then that process can be kickstarted and child gets the additional help that he or she needs. Again, this is a time that it's somehow not paid so much attention to the mental health needs of our children at this time. The stress is generally a bit more.
Everyone is stressed out.
Parents who have lost their jobs, even the adjustments to the schedule so that work can go on can be a potential source of stress for parents. The homework, we are assuming that those who are doing virtual school are happy to be doing virtual school because then they don't have to go to school. But that alone is a source of stress for our children. So we have to constantly reassure them, let them know that they are not alone and that it's a difficult time for us all, but together we will be able to overcome it.
What can a parent say to their child about stigma? Because we know that even though it's far better than it was last year by this time last year. This time last year we hadn't hit Ghana yet, but the whole idea of people coming out to share their experiences and all the rest is slowly sort of eating away at the stigma that has been there, But now these are kids. They're in a school. Somebody tests positive and it is known and this goes around, Stigma will be an issue. What can parents say to their kids that would help?
Constant education, constant reassuring of the children. So you tell them about the pathophysiology or what happens with the disease. If someone has COVID-19, test positive for the COVID-19 today, in about 2 weeks or a little more, we don't expect the person to
still be sick,
to be transmitting or to be infecting others after about 2 weeks, depending on the symptoms. But generally, after about 2 weeks, it's unlikely that the person will be infecting other people. And when it comes to stigma, what really, somebody is saying that, okay, I have to move away from this person because this person has something that I'm afraid I'll get or that I don't want. So that is the basis of stigma for many of these conditions. And once people understand that, okay, so this person tested positive for COVID, the person is no longer positive for COVID. So yes, I can interact with the person, I can play with the person, I can still love the person.
Yeah.
But now we are preaching physical distancing, not social distancing. Okay, physical distance.
Okay.
Well, yes, you
we
get
understand what it is.
Yes, so we are still free to love each other. We are still free to care for each other. Just that we should love each other enough to keep our distance to prevent ourselves from spreading the disease. So it doesn't matter whether you even know the person's status or not. Just assume that everybody is positive.
Yeah.
But when even you know that the person is positive and the person has tested negative for COVID, there's no need to be afraid or to worry or tag the person as, hey, these people, they are a COVID family, or this person is a COVID somebody. Already people are going through their own stresses, even the kids. So let's not compound it. And parents can help by educating their children and assuming that your own child becomes COVID positive. Would you want other people to stigmatize your child? No. So the education needs to be ongoing, and parents have a big role to play in this.
Now, the boarding school themselves, we know that not all schools are equal. We started out with Akosombo International School, very well-endowed school. But if your child happens to be in a school where they don't have enough Ronca buckets, they don't have enough hand sanitizers, they don't have enough soaps, at what point should parents proactively engage in ensuring that the schools are well-resourced so that their kids don't end up getting the virus, instead of maybe taking a step back to say, well, the school's not doing it, and just blaming it all on the school?
One major problem that I have found in Africa is that we tend to leave everything to our leaders. We tend to...
Or anyone of authority.
Yes, or anyone, we would rather they do it.
Yeah.
It's their duty, it's their role. But we all have a role to play. If my child attends a school and I realize that they don't have enough, or I see the physical distancing is not good enough, I have to speak out. I have to let the authorities know that I'm not happy with this. If there is something that the authority needs parents, for example, to contribute or support to do, parents should be ready to support or contribute to do. If you find that it's sanitizers that are not available, nothing stops you as a parent from providing some sanitizer or sharing. So there should be good communication. This is really about problem solving. And we want our kids to be able to study in peace and in a safe environment. So whatever we need to do to support them, we should be ready to do. PTAs should work with the school authorities. The schools should work with the Ghana Health Service, the Ministry of Health, to ensure that they have whatever they need to provide that environment that is safe for our children to remain in school. If we say that the children should go back home, there are some children who are going back home to a place without food. At least in school, there are some children who will be having some meals. There are some children who will go back home to be roaming or loitering about the community. We are talking about child abuse. We are talking about rape. We are talking about malnutrition. We are talking about even the depression and anxiety. For somebody, the school is a safe haven for them. So once they are in school, they have some peace of mind. They are not now thinking about their mommy's problems or their father's problems. So it's a safe haven for a lot of the children.
All right.
I hope I answered that question.
Dr. Hilda, it's always an honor to have you join us.
Thank you for
Thank you
having
so
me
much
again
for
and
being with
again
us.
and again.
Thank you. Thank you. Yeah, but we have a packed show for you. We'll be speaking with Akosia Konedu Yadom on